we're looking at keeping baby clean and comfortable. You probably have heard lots of different things about when to bath your baby or whether you should bath baby. Back along, when my babies were born, they've all had babies of their own now, babies were whipped away from you straight after birth and bathed before you even got to hold them. And then people started to realise that actually that wasn't necessarily a good idea, and it would always get the babies cold. So one of the main reason why we don't bath the babies too soon is just to help them with that changeover from inside to outside that we've always talked about now, because they struggle to keep warm enough to start with in the early days. You don't want to keep changing the temperature. So we don't bath them for that reason. Another reason we don't bath them is because we don't want to change the flora on the skin too much. And a lot of babies, unless they're very overdue, are usually born with a bit of vernix still on them, which is a creamy moisturiser stuff, which they have on when they're inside in the water for all of that time. And that's why the overdue babies, that's all run out by then. And so an overdue baby is often born with dry skin. While we're just talking about that, there's no need to lather the baby in lots of lotions and potions for that. As far as I'm concerned, the less you put on your baby's skin, the less there is for them to react to. If they are very dry skinned and they've got cracks on their wrists or down near the ankles, then a little bit of moisturiser just in those areas, and that could just be something like a bit of olive oil even, that can help in those areas. But you wouldn't want the baby actually putting it in its mouth, so you wouldn't put it on the fingers, and the rest it's only going to shed the dry skin anyway and have lovely skin underneath, so don't do that. But so we're trying to leave any vernixes on the baby to soak into their skin a bit, but that doesn't mean we leave them unwashed and with any vernix left in creases forevermore. If after a few days you look in their armpits and in their groin, if there's any vernix left, you need to clean it out. When we see baby, or over the years I've seen babies on day 5, which is often in the past be the first time we would see a baby undressed because they'd have been in hospital for a few days and come back, and we see them on day 5. We often find sore skin, broken down skin, with a risk of infection, an actual infection sometimes, in the armpits and in the groins, because parents haven't, maybe that they're a bit scared to bring the arms up enough to look and see, or they've been told to leave the vernix to rub in, or just haven't realised the need to clean there. But there are areas that are really important to clean, along with under the neck there where babies are sick. So when it is the right time to bath your baby is really up to you. I wouldn't do it in the first few days. But when you're ready at home, it should be a fun experience for you as a family. It should be a relaxing time. It can be a real good bonding time. In fact, one thing that I would suggest could work, because mum's getting all the fun of holding the baby all the time and feeding the baby, and dads want to be involved, rather than involving dad by suggesting he gives the baby some milk from a bottle, I would suggest dad has a bath with baby. In my head, in this day of modern houses with warm bathrooms, the best place to bath your baby is the bathroom. The clue's in the name. It tends to be warm, and you've got a bath, you've got water in the right place to fill the bath, and you've got towels handy. So I would suggest that you run a bath, have it at the right temperature for a baby. When babies are born, they're born into a bath water pool of about 37 degrees, so that's okay temperature for baby to have. You don't want it to be too cold, but an adult sitting in it wouldn't want it too cold, and you don't want it too hot. If you haven't got a thermometer to check your bath water temperature, use your elbow. How it feels to your elbow is how it will feel to baby. Don't rely on your hands because they're not such good judges of temperature. So dad would get in the bath, be leaning back, mum would undress the baby and pass the baby over to dad and baby can have some bath time. And all dad's going to do is not stick the head under the water to drown baby, and keep baby warm with some of the water around baby, have some bonding time, look into each other's faces, and then when all's done, pass baby back to mum, and you just need to get baby dried quite quickly so it doesn't get cold, and get baby dressed again, and that'd be baby's first bath time. It's just a good place to do the bathing. Having had the experience before myself of bathing a baby on the floor in the sitting room, and having the toddler running around, who then managed to fall backwards into the bath, getting soaking wet when he's already in his pyjamas to go to bed, and now I've got a wet crying toddler as well as a baby that needs feeding, and I've still got a heavy bath of water yet to lift out the room and tip away. So I just think it works better to use the bathroom. But that's a personal suggestion. So I'm going to look at cleaning this baby. So we would do the head first and work downwards, what we used to call topping and tailing. You can buy plastic top and tail bowls that are quite big, you'll find you end up with lots of bits of plastic and bits and pieces in your house with a baby. It's amazing how one little small person can seem to require so much equipment. So I would not buy the things if you don't have to. So you don't need to buy a baby bath because you can just use a big bath. You don't need to buy a top and tail bath. This is a lunch bowl. Something else that can be quite useful are the takeaway tubs from like Indian takeaway, because they've got a lid. So when you're out and about with your baby and you want moist wipes to wash baby with, rather than using baby wipes, which don't flush away, that can be cause all sorts of irritation. Even the 99% wet wipes are 99% water, but they've still got another 1% in. And a lot of the other ones we know they're really quite too strong for baby skin, especially on the face. You can never use a baby wipe on the face. But you might want to carry your own like flannels, literally just some flannels for baby, rinsed out in water, or you may want to make yourself some little baby wipes from a towel cut up, or you can use cotton wool and water. And if you're carrying either cloths with you, or you want to carry wet cotton wool with you, because then they're baby wipes, you can carry them in one of the takeaway tubs with the lid on, or you can put them in a plastic bag that you're going to reuse for the same thing. One of the problems with using baby wipes, apart from them being too strong for the skin, is that when people use a baby wipe, they don't then dry the skin afterwards. They just use wet wipes all the time. And that leaves the skin moist, and that is not a good idea. So by using cotton wool, you tend to then have dry cotton wool with you as well, and you dry afterwards. Or you can dry with a towel, actually, you can pat dry. So if you're going to wash baby's face, if you talk about the eyes first of all, we don't go out of our way to clean the eyes at all unless they're particularly sticky. If they're sticky, it's something that the midwives need to know if there's green muck in them and it's getting worse. But often baby's eyes are a little bit sticky just because the tear ducts aren't clear yet to drain everything away. So if they're sticky, you then need cleaning, and you would clean with a bit of clean cotton wool, and you'd wipe from the inside outwards, one wipe, one eye, and then the same with the other eye if it's sticky. If they're not sticky, only one eye is sticky, just clean the sticky eye. If you clean an eye unnecessarily, you're at risk of putting stuff into the eye rather than leaving it to just drain normally. Then you're also going to use a bit of wet cotton wool and clean around baby, cleaning like behind the ears and lifting its neck slightly and cleaning under there, because these are areas where the baby collects its milk when it's sicked some of it back up and doesn't like to waste it, and it gets smelly around there. So you want to clean, but then you also want to dry. But it's more of a patting, dry motion on a baby. You really need to lift them up and get in all those creases and around behind the ears. Often a baby, when it's sleeping on its back, will sleep with its head to one side, so then if it's sick, it rolls around behind that ear. And then if we undress baby here, notice I'm gathering up the sleeve to take it out, baby's arm out, because that way it's less likely to catch the baby's fingers. Let's get baby undressed here. And in case you're not aware, with these vests, these nice envelope necked vests like this, the lovely thing about these is if they poo got in a right old mess down here, you can bring these vests down this way instead of having to go the other way and wipe all your lovely baby poo all over its face. Obviously it hasn't got the real anatomy of a real baby here, but this is where I'm talking about needing cleaning. When you lift up a baby's arm in here, quite often the furnix is collected there. So again, to clean that, you would have a wet bit of cotton wool and wipe quite firmly right into the crease and wipe away. And then afterwards you want to pat it dry, because with two damp surfaces rubbing together, that causes friction, and that's why the skin breaks down and then it's risk of infection. And you do the same on the other side. And then if we just move down, I'll check baby out as we go down. Again, this is only a doll, but at this point on a real baby, you would have a cord attached. When baby's born, once it's had that bit of delayed cord clamping, the midwife will usually then invite the mum's partner to cut the cord, and with a clamp on here, a plastic clamp which stays in place afterwards. And we're nowadays asked to leave the cord about that long, so that will hang down here. Now if that clamp stays on the end until the cords come off, and so what you can have after 20 weeks, to start with, that cord is like bacon, right? It's floppy, but it's tough, and it's moist. As it dries out, which is a process it has to do to come off, it goes hard and then it stays wherever it's dried. And what you don't really want is this clip on this long bit of cord dried down here, because then when the baby moves around it digs in and leave red marks, making it uncomfortable. Can be some of the reason why a baby's uncomfortable. Much better to flip it up that way while it's wet, while you can. Hold it there with your nappy, so your nappy's nice and on firmly, and it'll dry there. Within 24 hours it'll be dry. And then once it's dry, it will always stay up there and it's out of the way. It causes less problems up there. One thing over the time, and I don't know that this has been researched by anyone, but I think that now that we do delay cord clamping, as a rule, those cords come off that bit earlier. So it's going to be usually within your time in midwifery care, so up to 10 days that it comes off. A lot of them come off now around day 5, 6, rather than nearer to 10. So that's good. It always looks nicer once it's off. But the umbilical cord, that is one area where we're looking for infection, and somewhere that as parents you need to be aware of. That if we see any redness on the actual skin of the tummy going away from the cord, that's a sign of infection being in there and spreading away, and that is something that someone needs to know about. Medical person needs to know about that day straight away. Don't leave it till the next day or the next day to let someone know. They do dry out, they do separate, can get a little bit bloody. There is a little bit of a smell to a cord, which is all that stuff is normal. But it's really the redness going away is our main concern. And certainly if your baby's unwell anyway, it's one of the, or you're thinking baby might be unwell, it's always worth having a quick look at the cord and see if there's redness there. But do get someone to have a look at it if you're worried about it. And then we're going to dry that cord up, and then we're going to look at cleaning the nappy area and type of baby girl I suppose we've got here. But the main thing about a baby, the only thing really about the baby boy, apart from the fact that they may well fire at you, because as soon as you take a nappy off and the cold air gets there, it makes them wee. You can always get a warning because it's there and you cover it back up for a second, and then once it's down. The thing about a baby boy is they've got lots of creases to clean. You really have to move everything out of the way and to get in there and to clean properly. And I was asked this once in one class, I will mention it. You would never with a baby boy try to push the foreskin back at any time. Just leave all that well alone. Never, whatever age your child is, do not start trying to move the foreskin back. But just clean all the creases and dry well, okay? But baby girls, there's a couple more things to know. So most baby girls, well, all baby girls, after a day or so, they start having some clear mucousy stuff coming out of the vagina. It's pretty much similar to what a mum would have from a show, and the same sort of clear mucousy stuff. It will be stringy and mucky. You wipe off what's on the outside with your cotton wool and throw it away, but you shouldn't part the vaginal lips and try to clean inside at all, because you're likely to put infection in. You must always clean a baby girl from front to back. So if you're lifting legs and you're cleaning here, cleaning any muck and poo off, you wipe it backwards, so you don't wipe it up into the vagina. Just a good idea to get in that habit even with a baby boy. You never know, you might have a baby girl next time, or be doing a friend's baby. So you don't want to clean inside for that. Something else with a baby girl is they may have a pretend period, and that really surprises a lot of people and can worry and scare people if they see it. It does happen. It's really I think one of the most exciting things about having a baby girl is the fact that if you know you're having a baby girl even while you're pregnant, you're actually carrying half of your grandchildren in there as well, because that baby girl's already got the eggs in her ovaries growing inside her while she's inside you, and they're your grandchildren. So she's obviously got the uterus, she's got the lining of the uterus, and so her body and the lining of her uterus is reacting to the hormones that you've got in your body. So sometimes when they come out of you and come out of the hormones, that lining will shrink back down a bit and she'll shed a bit of blood. It's like old period blood, but only very small amount. If you're worried, get it checked out, but don't be surprised if it happens around day 2, 3, 4, and it should only be a small bit. The other thing just to say, and again this is a suggestion from me for something to be aware of and to think about, is about the use of talcum powder on a baby, because there is a lot of evidence from, there's court cases going on, shall we say, in America about the link of using talcum powder in the nappy area on baby girls and ovarian cancer later on in life. And so it's not a good idea, basically. I personally would not risk using it. It doesn't really serve a purpose anyway. And just lately there is concerns about what talcum powder actually contains in it. If you do choose to use powder on your baby, somewhere else on the baby, don't shake it out of the pot all over the baby, because the baby can inhale it. You would put a little bit onto the cotton wool and just dust it around. So that's about cleaning down there and drying well, as we've said. And then there's the issue of baby cream, a nappy cream, whether you need that or not. The first type of poo that babies do is meconium. We have a wonderful guide here, which is actually a feeding guide, but because weeing and pooing is a really important part of how your feeding's going, got a guide of baby poo there for you. Be experts on this as well. But the first stuff that they do is meconium. It's very thick, sticky, almost tar-like, and it can stick to their skin. They can do it 5 minutes after you change the nappy, and then it'll end up being there for a few hours, and it will stick to the skin. And then when you're trying to wipe it off, it can make the skin sore because you haven't rubbed so hard. So it's a good idea to put some cream or even a bit of Vaseline, whatever you've got, as a barrier on their bottom to stop that sticking. So it makes cleaning them off a lot easier, nicer for baby and easier for you.